Inflammations are of two types, acute and chronic. Acute, again of three types, acute laryngitis, acute epiglottitis, and laryngotracheobronchitis. Laryngitis, the causes are of infectious type and non-infectious type. Infectious is mostly following the upper respiratory tract infections, and non-infectious is due to inhalations of or ingestion of corrosives, trauma or allergy. Clinical features are CHD, C for cough, H for harshness of voice, D for discomfort in the throat. On examination, vocal cords are initially white and normal. Later, they become hyperemic. Apart from this, epiglottis and aryepiglottic folds become red and swollen. Epiglottis and aryepiglottic folds become red and swollen. Treatment is by giving antibiotics, steroids, and analgesics. And avoid smoking and alcohol. Cough sedative can also be given. Epiglottitis. It involves only the epiglottis, whereas laryngitis involves whole the larynx. Epiglottitis involves only the epiglottis. In laryngotracheobronchitis, it involves trachea and bronchi also. In epiglottitis, the infectious agent is Haemophilus influenza, and laryngotracheobronchitis, it is para-influenza. Clinical features of epiglottitis are fever, which is sudden in onset and high grade, so they look toxic. Whereas in laryngotracheobronchitis, fever is slow and low grade. Stridor is common. Along with this, there is odynophagia in epiglottitis. As epiglottis is involved, there is odynophagia. As bronchus is also involved, cough is seen. And in radiography, thumb sign is seen in epiglottitis. Thumb sign is on lateral view of the neck, there is thumb-like impression due to the edema of the epiglottis. Steeple sign is seen in laryngotracheobronchitis. Steeple sign is as the tracheal edema occurs, there is narrowing of the trachea in the subglottic region. In the subglottic region, there is narrowing of trachea. It looks inverted V shape, so it is called as steeple sign. And treatment for both of these is antibiotics and steroids. If necessary, tracheostomy. Coming to the chronic inflammations, chronic are without hyperplasia and with hyperplasia. Without hyperplasia is diffuse and symmetrical. It is symmetrical and diffuse, it involves the whole larynx, whereas with hyperplasia is diffuse or localized. It is only diffuse, and this is diffuse and localized. Etiology, to remember, you don't have, it is without hyperplasia, so wait till it gets hyperplasic. So wait, S for smoking, O for occupational, V for vocal abuse, A for alcohol, I for infections, T for trauma. Clinical features are both common, CHD, cough, harshness of voice, discomfort in throat. On examination, as the whole larynx is involved, the larynx structures are hyperemic. Vocal cords are red and round. Mucus is seen on the vocal cords and interretinoid regions. Coming to the examination of chronic laryngitis with hyperplasia, laryngeal mucosa becomes red and thickened because the pathology behind chronic laryngitis with hyperplasia is first the changes occur in the glottic region and they extends to supraglottis and subglottis. Later the mucosa, submucosa and laryngeal muscles are also affected. As respiratory mucosa is of pseudostratified ciliated epithelium, it changes to squamous type. And squamous epithelium of the vocal cords, it undergoes hyperplasia and keratinization. As a result, vocal nodules or vocal polyps or rhynchus edema may occur. So, as vocal cords undergoes hyperplasia, it becomes red and round and swollen. Ventricular band or vestibular folds are red and swollen, and cord mobility is impaired due to edema. Treatment: First, treat the cause, like avoid smoking, alcohol, treat the infection. For harshness of voice, voice rest and speech therapy. And surgical treatment is vocal cord stripping, that is removing some part of the vocal cord. In some cases, removing hypoplastic and edematous mucosa is also done in selected cases. There are other inflammations of larynx like pachydermal laryngitis. It is bilateral chronic hyperplasia. Here there is granulation tissue, red or grey granulation tissue, which undergoes ulceration on constant talking or constant singing. It forms a contact ulcer. Treatment is by removing granulation tissue.